It's not a cancer that hits the headlines on the news, but it's not any less important and still needs research, awareness, and proper treatment from the get-go.
That's Katie Wintergerst, a patient with sarcoma. We'll hear more from her later in the show. Welcome back to Cancer Buzz, the show delivering what you need to know in cancer care. I'm your host, Summer Johnson. Sarcoma accounts for 15 to 20% of childhood cancer cases, but for adults, this type of cancer is rare and often misdiagnosed. Its low rate of incidence means these patients often face diagnosis and treatment delays. This is largely because many community care providers lack experience with diagnosing or caring for patients with this rare disease. Most providers may not even see a patient with sarcoma in their career. Our first guest explains how community cancer centers can leverage partnerships to improve care for patients. Dr. Richard Riedel joins us from Duke Cancer Institute in Durham, North Carolina.
Sarcomas represent an extremely heterogeneous and rare group of diseases. They can occur anywhere on the body. I often will tell patients they can occur from the tip of the head to the tip of the toe. Depending on the reference that you referred to, there are anywhere between 50 to 100 or perhaps more than 100 different histologic subtypes. They represent 1% of cancers in adults, and approximately 15,000 individuals in the U.S. will be diagnosed with something called a sarcoma this year.
What challenges do community cancer centers face when treating these patients?
Well, there are significant challenges when dealing with individuals diagnosed with sarcoma. In the community-based setting, I think it's particularly challenging in part because the care providers may only see a couple of cases in their career, maybe a case every couple of years. And so it's really critically important to partner with centers with disease-specific expertise, academic centers, for example, that are well positioned to partner with community-based providers in providing optimal care for patients.
What do community cancer providers need to know about this disease?
Sarcomas typically affect a younger patient population, although all age groups can be affected. A significant proportion are considered young adolescent or teenage and young adult patients. And so these are oftentimes individuals who perhaps may still be in school or are fresh out of school and starting a family, perhaps in a relationship. And so there are significant challenges and psychosocial needs that go along with dealing with a potentially life-threatening diagnosis in an otherwise young patient population. At our center, for example, we bring a number of resources to bear, including psychosocial support, in addition to the ancillary support that's more directly related to the needs of the patient, for example, related to surgery or management of chemotherapy and or radiation therapy side effects. But it goes beyond just the management of the treatment-related effects. It really is the psychosocial aspects that go along, again, given the age population that oftentimes is affected.
Why are patients typically treated in the community setting versus specialty centers?
The number of sarcoma centers in the country with disease-specific expertise are somewhat limited, probably around 50 to 60 centers nationally. And there are certainly areas in the country where there may be several centers. For example, in the northeastern part of the United States, for example, there are several care centers, but you can imagine in the more western states, for example, there may be several states with no center of expertise. And so the financial challenges, the time commitment to travel to these centers can be burdensome for patients. There are certainly virtual consultations for centers who have the ability to do that could help mitigate some of those barriers. But I think the challenge really centers on the number of centers nationally with disease-specific expertise and then the location of those centers and one's ability to travel.
Do treatment options vary depending on the care setting?
There are a growing number of treatment options for patients, many of which are available in the community setting. In thinking about a very recent FDA approval of an engineered T-cell product in synovial sarcoma, that particular agent is unlikely, at least to start, to be available in the community-based setting and really only available at authorized treatment centers. And so as we make advances in sarcoma, as the number of agents become increased, my hope is a lot of this will trickle down to community-based settings. Much of our treatments are more conventional cytotoxic chemotherapies, for example, or oral tyrosine kinase inhibitors, all of which can be administered in the community-based setting. But as we make advances, particularly for some rare diseases, and given the complexity of some of those agents, they may not be available in the community-based setting.
What can be done to connect providers with more information about sarcoma?
I think there have been a number of potential strategies. Certainly, there are national guidelines through, for example, NCCN, the National Comprehensive Cancer Network, which has guidelines both for soft tissue and bone sarcomas that community-based providers can readily access. There are also a number of patient advocacy groups, for example, the Sarcoma Foundation of America or other sarcoma-specific histologic patient-facing advocacy groups that are there to provide assistance and helping to identify centers. The ACCC, for example, has partnered with the Sarcoma Foundation of America to make many of those resources available from the SFA available to ACCC providers. And those include things like webinars on specific treatment approaches, such as immunotherapy, for example, in sarcoma, as well as clinical trial matching strategies and other resources that are critically available for patients. So I think certainly partnering with national initiatives like guidelines, partnering with patient advocacy groups like the SFA or other specific groups, I think all of those are efforts that can bring information to patients. And patients many times are information seeking as well. And they will often find information, or they will find social media groups of patients, for example, who share a similar diagnosis, or they'll receive some information from those avenues as well.
What should community cancer centers prioritize when treating these patients?
Well, I think for a community-based provider who may have an individual with a new diagnosis of sarcoma sitting in front of them, I think really working hard to facilitate a consultation with a disease center expert is critically important. When pathology, for example, comes from a community-based setting to an academic-based setting in sarcoma, the diagnosis can be changed up to about 30% of the time. So pathology review is critically important in a center with expertise, in part because the treatment for patients is becoming increasingly nuanced, increasingly histology specific. And I think the worst thing that could be done would be for an individual to initiate a particular treatment for a diagnosis that they don't have. So I think pathology review at a center is important. Having individuals seen at a center with expertise is important, so the disease-based centers can effectively partner with community-based providers, again, for providing or attempting to optimize the care of patients.
You heard from Katie Wintergerst at the start of the show. She's here to share her perspective as a patient with sarcoma.
So I guess I'll go back to 2015 when I first started having just a spot in my leg that kind of started bothering me. It felt like a muscle that kind of cramped and then just kind of held. So like a small knot. Didn't keep me from doing any of my normal everyday life activities. And so I was actually pregnant with my first child at the time. Brought it up to my physician. They felt that it was likely, ligament stretching and just your body adjusting to pregnancy. So we would just keep an eye on it. So that was 2015. Turns around 2017. I'm pregnant with my second child, still continue to have somewhat of an issue. They said, okay, we'll go ahead and further investigate after you have your child. And so she was born in September of 2017. And then said, okay, let's figure this out because it really is bothering me, which led to a biopsy and scans, and where they found at that time a stage 3 synovial sarcoma mass in my adductor muscle on the left leg. I went through the standard of care chemo, radiation, and surgery in 2018. Came out of surgery with clean margins, thinking the worst is behind me. Nothing else has shown up in my body. Let's keep monitoring, but move on. And unfortunately, the first spot showed up in my lung in March of 2019. So since 2019, been on a variety of standard of care and trial treatments, trying to keep the cancer that is spread to my lungs at bay from growth. We've removed a couple nodules, and have taken a stance of, let's keep this from growing further and spreading anywhere else. So obviously stability is kind of the best scenario for me at this point.
How would you describe the typical understanding of sarcoma among those diagnosed with it?
Yeah, so I think probably most people, when they're diagnosed with it, don't know what sarcoma is. Before I certainly had never even heard the word. So sarcoma is cancer. It can originate in the soft tissue or the bone, anywhere throughout the body. I tell people mainly it's a cancer of like bad luck, meaning that it's not genetic. There's no link to anything genetic that would bring this on.
What challenges do patients with sarcoma face?
I think it gets misdiagnosed or delayed diagnosed quite often. I've heard about that from others as well as experienced it myself, where doctors just generally aren't as familiar or don't see sarcoma as often unless it is their specialty, to where that's probably not the first diagnosis that they would go to. So I've read stories and heard people talk about plenty like whoops types of operations or procedures where they thought they were going in for one thing. It wasn't, turns out to be sarcoma, and then perhaps you've created more of a problem to deal with.
What makes sarcoma unique from other types of cancer?
I would say understanding that it's not a cancer that hits the headlines on the news. There's certain cancers out there that they get the news. They're kind of like the sexy cancers. They're getting, a large majority of the funding. But because sarcoma doesn't hit those points, it's not any less important and still needs research, awareness, and proper treatment from the get-go.
How have you navigated clinical trials?
Specifically within sarcoma, what I've had to become comfortable with and learn and experience is that clinical trials can be tricky and they can be scary, but in the world of sarcoma, there hasn't been a lot of new products FDA approved for treatment. So clinical trials is where the work is going on, and those are the treatments that you want to be on. Obviously, for insurance purposes and medical standards, the clinical trials are often offered at the sarcoma treatment centers. And I've participated in trials that have primarily been stage 1 and 2. So I've done 3 trials now. I'm not currently on a trial, but being comfortable with trying something that may work or may not work, the side effects may be known, may not be totally clear, but this is what the research is proving. And obviously standard of care didn't do its total job in the beginning. And so, this might be your best scenario for right now.
What message would you like to share with community oncologists?
I would just task or encourage the community oncologists to educate themselves and try to avoid mistake diagnosis at the beginning to give the patient the best chance of success in life from the get-go. Encourage, when something feels like it might be leading down that path, encourage further education and connection to some of those resources that are out there, and really view it as like a team, in that the patient and the local oncologist can be co-captains of a team, because the patient's got to know their body. The medical professional needs to know the science, but they also might need to call in a second professional who they can at least consult with to get some backing on a treatment plan.
Thank you to our guests today. You could take a look at the show notes for sarcoma care resources, including a new curated list of supports for providers and patients that was developed as a partnership between ACCC and the Sarcoma Foundation of America. If you liked what you heard today, we hope you'll share it with your colleagues in community cancer centers. Until next time, for the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.